Hi, welcome to one more session, and we are going to discuss very important topic, uh, the career opportunities or how the profession is going ahead, especially in the next 5 years. We are having an unprecedented evolution in the field of dentistry and medicine. The digital revolution that seized India in the early 2000 has permeated to all medical technologies and affecting per se the entire medical and dental ecosystem. Uh, Welcome to the campus musings and join me for the lectures on how are the career prospects. Okay, the future proofing your medical career. Why upskilling is non-negotiable. Here, upskilling and cross-skilling means upgrading yourself, adding your certificates or knowledge on disciplines other than your core medicine or dental. The Indian healthcare landscape is featured by saturation in clinical position. Every year, nearly 1 lakh medical graduates, MBBS graduates, and about 27,000 dental graduates come out of Indian medical and dental colleges. And furthermore, there is a drastic increase in medical seats, and there is a promotion of the alternate medicine and other holistic approaches. Coupled with this is the technological advancements and the population itself. There is a shift in healthcare requirements and needs. So there is a more emphasis on prevention. On the contrary, the longevity is increased. So there is a challenge. The saturation, while the traditional medical and dental uh, features alone won't suffice because of the saturation of clinical jobs. There is a heavy competition at the undergraduate level and to an extent at the postgraduate level, and there is a omnipresent underemployment of medical graduates, especially in clinical jobs where the direct patient care is involved. In addition to this, we are having the competency-based medical education and AdCom modules adding up to the burden of education that is shifting from the outcome-based medical education. Coupled with this fact is the AI disruption. The projected global value of artificial intelligence in diagnostic fields such as radiology is by 150 billions by the end of this year, meaning slowly diagnostics specialists are being partially replaced by artificial intelligence. The medical ecosystem shift is more on preventive care, reducing the need for tertiary care. There is telemedicine, value-based care models being involved, insurance sector. There is a total disruption in the field. At this juncture, your traditional medical skills and jobs are turning obsolete unless you update yourself. There is an urgent need for young medical professionals to enhance their skill set for future-proofing their careers. So, this data-driven healthcare revolution, how does that work? Because the integrated data, merging financial, social, wellness data for personalized care is the need of the hour. For this, you need to have a sound knowledge of analytics and artificial intelligence knowledge, which facilitates decision in diagnostics, treatment plan, and healthcare management. Meaning, the future doctors will not be only medical doctors, but should have a good knowledge on all of these fields. So, it is up to them to be prepared for the eventualities. Either you adapt or risk obsolescence in the near future, because automation is the mantra of the current era. There is an increasing pressure on all stakeholders to deliver value rather than volume. And there is opportunities lying only in the high growth roles where there is cross and transdisciplinary requirements. The sectors in medicines that you need to watch include preventive care, retail clinics, and home health solutions. Remember, WHO projects 9% annual growth in health informatics role by another 5 years, whereas the traditional roles are diminishing by astonishing rates up to 30%. So, what fields are emerging important? Artificial intelligence, machine learning for medical applications, data analytics, finance, healthcare economics, policy administrative leadership is a big area that is opening up. Research sector is booming, not only pharmacological sector, but all other, including machine interface. Internet of medical things, sensor-based technology is point of care technology, preventive technology are blooming like anything. The rise of the machines is inevitable and has already started. Now, whether you join the winning side or becoming absolute is the matter of question. So you start today, you will lead tomorrow. You need to self-assess, identify interests that you are aligned with. Either it could be artificial intelligence, analytics, telehealth, administration, economics, anything. Choose while doing your course itself one certification program, at least have a sneak peek to complete within the next month so that you have an idea where to pursue. And start enlarging your network. If you're interested in research, start publishing. Otherwise, join your corresponding community so that you have a first-hand idea what is happening, so that you are prepared so that to lead tomorrow. Your future is in your hands. The healthcare rapid evolution emphasizes the necessity for adaptability. If you don't adapt, you are left out of the race. Upskilling or cross-skilling equates to career security, professional leadership, and position as the leader in innovation of tomorrow. Start today, lead tomorrow. The best time to upskill was yesterday. You missed the bus. So the next best time is now. So start about it. In our next couple of videos coming up soon, you will start seeing why traditional medical and MBBS or BDS is not alone sufficient. If I need to do or take some additional certifications or ideas, how to go about it. I will brief you on some of these features in the upcoming videos. The future belongs to those who adapt. Upskill today to stay relevant tomorrow. Change is inevitable, whether you are going with the growth or without it. That is in your hands and your motto. And remember, upskilling doesn't replace your core medical training, it enhances it. With technology taking over routine tasks, your ability to work with data, AI, and other technology will set you apart from your classmates. So, the right time to start pursuing out of the college courses, additional certification knowledge base is right now. Pick one or two of these skills to start. They are practical, in demand, and will help you to adapt whatever change comes in healthcare in 5 years or 2 years from now. The future belongs to those only who prepare for it. By upskilling now, you are not just securing your job or profession, you are positioning yourself to lead healthcare innovation tomorrow. So you are preparing for tomorrow. Thank you, and wait for our next sessions where we will work on all these things in subsequent videos. Keep joining me for our next session. Thank you.